issues. I know it's now time for our health segment.
Yes, it is.
And today we are discussing facial injuries. That's interesting, right?
Facial injuries, like that's an interesting topic.
You know, our resident or our guest, Dr. Kalsum Zakaria Adam, will be joining us pretty shortly. And you know, I don't know, but does concussions form part? Hi, Doc. You're welcome. How are you doing?
Very well.
Amazing, amazing. I was trying to get those thoughts on the discussion we'll be having today, right?
Yeah.
Facial injuries, and I was wondering if concussions are what you can describe as a facial injury.
So there are a number of them that we are going to talk about. So concussions can occur in various different parts of the body. So if you have soft tissue and then some bleeding within it with some edema, yes, you have some concussion.
So it's a facial injury.
So facial injuries, let me start from the classifications.
Okay.
So when you take the face, okay, you have the hard parts and then the soft parts.
Like your forehead is hard.
Exactly.
Your cheeks are soft. And your chin is hard.
No. So even the forehead has a bone there, so which we call the frontal bone. Okay. Then the cheek also, you have some bones there, a number of them. You have the main cheekbone, which we call the zygomatic bone. Okay. And then you have part of it is also being formed by something we call the maxilla, which forms the mid face, most of the mid face. Okay. Then when you come to the lower face as well, you have the mandible, which is your lower jaw. You get it? So those are the hard parts of the face. And the face is made up of different bones, about 14 of them, 14 different ones. Okay. And the soft parts, I mean, is you have some muscle there, you have some skin there, you have some fat there, you have your blood vessels, and then your nerves and all of that. You get it? So those are basically what the face is made up of. And then you have vital structures as well. You have your cartilage for your nose, you have your eyes, okay, and other vital structures within this area. And even in the mouth, you have your teeth there, and then you have the bone. So all of these are just different components of the facial region. Now, this facial region is very important because it needs to be protected, especially when it comes to transportation. So most people tend to, because it's prominent, that's the first part of the face that you see, it's sticking out. If there's some form of injury, it tends to be affected. You get it? And the injuries can be in different aspects of it. It can affect the hard part, it can affect the soft part. So if it affects the soft part, then we are talking about, let's say it's just the epithelium or just the skin part of it that has been scraped off. So that's an abrasion. So sometimes you see that there's this scratch. So let me just say a little scratch on the skin, then that's an abrasion that you just need to do a little, some dressing, and then you would have taken care of it. But when you have deeper cuts, we call them lacerations. So deeper cuts that go through muscle, that goes through the whole thickness of the skin and then goes into deeper structures, then these are lacerations that you talk about. And the concussions that you spoke about, where you have some edema and then some form of bleeding within the tissues that makes it edematous eventually, then you have that as well. And then when it comes to the hard tissue injuries, anytime you have some break in continuity of the bone that you have, then you would see that there's some fracture there. And the fractures are different depending on which part of the bone has been affected. So these are some of the injuries we are talking about. And I'm sure in the background you see a skull that is showing different fracture points in different. So this is typically what you may end up seeing in a road traffic accident patient. A road traffic accident patient.
Why it looks so distorted.
Exactly. So you can see lines. So those are the fracture lines. Okay. Wow. So you would see this in road traffic accident patients, especially those who do not protect themselves, who do not have protective clothing, like typically what we would all advocate for, which is the helmets. You get it? So sometimes you may end up with this, and if a patient presents with this, you can see that almost every bone within the face is fractured.
Yeah.
So we call it panfacial fractures.
A what?
Panfacial fracture. So it's like the whole of the face has different multiple fractures at different areas. And these injuries usually do happen as a result of, in fact, number one is road traffic accidents. So road traffic accident as maybe a motorcyclist, or road traffic accident as a pylon rider, so a passenger who is riding on a motorcycle, or you have it as a pedestrian who is crossing the road and then is met by either a moving vehicle or these motorcyclists. Now, even when you have the car stopping for you to even cross, you have to double check because of these motorcyclists that can just come out from nowhere and then end up causing injuries. And then it can also be as a result of falls. Okay, it can also be as a result of assault. So if there's assault or some form of fall from a height, all of these are some of the etiological factors that can lead to some of these injuries that you can see on the screen right now. But coming back to it, you notice that when you look at the epidemiology, most of it, especially in Kolebu, we have actually done a study to show that there are a number of these road traffic accidents that lead to facial fractures. Now, most of it, the etiology, you notice that is from road traffic accidents. About 55% of it is from road traffic accidents.
55%? That's more than half of that.
Exactly.
What is the close section?
So most of the time, you see, when you say that, in fact, in a month, we see more than, if I should just say, just from the top of my head, we see more than 30 cases. You get it? And these are, I mean, the realities. So 55% out of all the facial injuries that you see is from road traffic accident. And just not to burst your bubble, out of that 55%, majority of them are from motorcyclists.
I'm not surprised because
who are unhelmeted.
I recall
Most times when you see them, they're not wearing their helmets.
I recall going to help a Christmas child.
Okay.
We donated to the burns and plastic surgery unit of Kolebu. At the time, Dr. Poku Ware was heading the department.
CEO, yeah.
Oh, I know. It was.
That's terrible. Huh?
Oh, Jesus. Like every single time they were bringing in somebody who either the leg, the arm, the head, you know, and we were there for like a couple of hours. I saw like 3 cases within that short period I was there.
Yeah.
So I'm not even surprised.
Yeah.
Another point I wanted to make, if you look at the statistics on road accidents, it's in the last year, for example, it killed more people than COVID did.
Yeah.
It killed more people, or it's killing more people than malaria.
Yeah.
So it's a public health concern.
Exactly. Very, very important, especially. And you see, when you even compare the statistics, you notice that as far back as 2012, Nigeria actually banned the use of Okada in their main one of their main cities. That's Lagos, the major roads, and that's as a result of the fact that majority come from these motorcyclists and not enforcing the road traffic regulations. Because you notice that a lot of the motorcyclists will just go past the
red lights.
traffic, without any sanctions, and they are not wearing helmets, and the riders or the pylon riders are also not wearing helmets.
Right.
And when you are facing such a situation, the injuries that you may present with is typically what I have shown in the screen there, where you have multiple bones actually being fractured. And not only so, you wouldn't see, this is just the skull showing you the fractures. So you can imagine the soft tissue aspect of it. You get it? So there'll be multiple, as I mentioned earlier, there'll be some lacerations somewhere, there'll be some abrasions. concussions, all of that, contusions, and all of that.
How do you treat
Depending.
and manage this? Because, I mean, from a lay person's point of view, I'm looking at this and I'm thinking, there's no way you can salvage this situation.
Oh, it can be salvaged. It can be salvaged.
And you'll
But
get
it
your
takes,
structure back?
I mean, you
To a
will
certain
get
degree.
yes. So mostly is to restore function, because the facial region with the bones, what mainly the functions of the facial region and the bones is, at least it helps you to feed well, it helps you to speak, it helps you to breathe. You get it. So those are some of the things that you would want to make sure that you would have restored. So if you are looking at these fractures, there are classifications. So the lower jaw, the movable, the one that is mobile or the movable one, once there is some fracture, we call it mandibular fractures.
Okay.
So it can be fixed. Now the mid face, which is when you draw an imaginary line through the pupils and then a line through the closal surface of the lower jaw. You notice that that's the mid face, and that also, there are different classifications depending on the lines of fractures. So some of the fractures may start from the nose or the bridge of the nose, and then starts and go all the way to the eye region and come down and go to the zygomatic ridge. So that's one area. If you look at the picture, you would see it. Now, some can happen through just the orbits where the eyes are, and then move backwards. Okay, others too can go through just the lower jaw. Depending on it, when you do have these fractures, the first thing is you need to make sure that the patient is what? Safe and alive.
Right.
So safety, and then the patient is alive. Once that is done, then you would have to assess the types of injuries that they may have presented with. So depending on the, as I mentioned, any of these bones that are affected. Now, for you to be able to make the complete diagnosis, you need some imaging. So the imaging would mostly be your CT scans. So you take your CT scans, and the CT scans would be able to tell you exactly where the fracture lines are. Then based on that, you would have to plan to take them to theater and then do the surgeries.
How common is this among contact sports, right? So
Yes.
you mentioned road crashes.
Yes.
You break down to tell us it's worse even among motorcycles.
Yes.
But we also, I mean, football, we watch football a lot,
Yeah.
right? And we see a lot of these fractures. Every now and then your
Exactly.
favorite player has a fracture and he's off. That kind of
Yeah.
thing. How common is it?
Okay, so when you compare the statistics between developing countries and developed countries, you notice that the main or the number one source of facial fractures for the developed countries is assault. Yes, it's assault.
Not even
And
like-
it's because of...
Not even crashes.
Yes, it's no, not crashes. And then sports is number 3.
Yeah, to be
That's
fair, like they
number
do
two.
all
Yes.
of those NFL, like all of
You get
those.
it. And that's as a
rugby.
result of the different rules and regulations we do have. People, I mean, when you go to the developed countries, they are free to use guns. They are free to use all of these weapons compared to
I mean, if
here.
you look
So
at it,
when you can actually see that there is the number one etiological factor varies according to
region.
the geographical area.
see, America has a gun problem, right? It's not this
They don't want to admit it.
top of my
So
head.
gunshot
I think now-
injuries,
Yeah. they
Are
top
also
there.
top.
Yeah,
Yes.
Right. Top of my head, there are so many gun violent movements.
Yes.
Right.
Then in the UK too, at the point there was a stabbing incident, like a series, a spate of
Yeah.
knife violence in the UK.
Yeah.
You know, so it makes for interesting analysis.
Yeah.
The causes of these fractures. And you say
Depending on
outside of assault, then sports come.
yes, then sports is
Because
number
there's a lot
3.
of Contact, like
Yeah.
very active contact sports.
Yeah. So for that, usually you'd have these facial fractures, especially when you get the impact directly on the face. So that's why usually they are asked to wear mouth guards. Okay, so these mouth guards would be a little protective of the mid-facial region as well as the teeth on that side. Once you don't have it, it goes. You end up having any of these fractures depending on the weakest point. So anytime there's an impact, the bones are able to dissipate the forces, and the weakest points are usually the vulnerable areas that get fractured. Wow. So that is why you would end up with such a fracture. Wow. Different or multiple bones being affected. So you can see that part of the frontal zygomatic suture on there. Yes, let me not go much into details. But you see, yes. So you see where the eyes are. Yeah. You can see there's some break there.
Yes.
So that's the rim. So part of the rim there, it is fractured. When you come to the nasal bone or the nose, the bone that supports the cartilage of your nose that we see externally, you see that there's some fracture there.
So a boxer can come to the hospital looking like this?
So a boxer may not have this severe form of fracture. Boxer may end up having more of the soft tissue injuries because of the impact. Exactly. Wow. So more of the soft tissue injuries. So he may end up with a lot of hematoma. He may end up with a lot of the contusions.
So the soft tissue is the one that leads to the inflammation?
Yes. So the so inflammation, every part, once you have blood supply to any part of the body, you can end up with inflammation. So inflammation is just a way, it's a response, a protective response to show that you are healing. You get it. So any part of the body that has which is viable, that has blood supply, has the tendency to undergo inflammation. And the inflammation will have the swelling, the pain, all those things related to it. So as we were talking earlier, such a patient will typically come with certain signs and symptoms. Signs and symptoms may be that they may not be able to chew properly because you can see that there are different fracture lines. Others may be that anytime they try to put their teeth together, the back teeth meet and the front teeth are open. So it affects the function for eating. Others may be that the tongue is actually related to certain, there's something we call the genial tubercle. It holds, so the bone, the jawbone holds the tongue. But if there's some fracture there, it means that the tongue will fall back. Wow. So if the tongue falls back, they will come with some respiratory. Remember I mentioned that it will compromise either your speech, your eating, and then even breathing.
Wow.
So these are some of the things that they may present with, aside the fact that they would come with the swellings, and then there may be nosebleeds as well, and then some of them may even have, and you definitely would have to make sure that the C-spine, where the C-spine is actually not affected.
Is that why usually after
you'd have a collar?
Victims, you have the neck support.
So that you end up protecting the C-spine in that regard.
Can you also share with us post the fracture, right? It means that a surgery would have to take place.
Yes. So the surgeries can either be you having to fix some plates to put together the fractures. So they'll put, let me say metals so that it can heal. So you would want to put it together. First of all, you want to reduce it to its pre-fractured state. Okay. After reducing it, then you fix it. Then after fixing it, you immobilize so that it will heal.
Does it mean that those plates that are being, you'd have to go back into surgery to have them removed, or it's forever?
No, so there are certain, so let's say for instance in children, pediatric cases, you may have to, if you use certain plates which are not resorbable, you may have to go back and remove them. But if they are not that, then you would have to leave them in. So they are titanium plates, they are biocompatible. So you may not have to go back in. And
if you're going through an airport, you always have to take a doctor's report.
So is this where plastic surgery comes in?
So it's both ways. So plastics may be if you do have some avulsion injury. So avulsion injury is you have lost part of it. So say part of the lip and you've lost everything. There's complete detachment of part of it. Okay. So you may have to now reconstruct it. Okay. You get it. So that is where plastics comes in. Other than that, you should be able to put the stitches together or put the soft tissues together once it's laceration or any of these things, and make sure that there's no source of infection as you are putting it together. Wow. And if you should fix as well, you need to fix it around something we call the occlusion. So the occlusion is when you put your teeth together, the relationship that the upper jaw has with the lower jaw. There's some relationship. And that's that harmonious relationship that helps you to chew, that helps you to do any other thing, talk, and all of that. But then if you are fixing, you need to make sure that your fixation is around that occlusion. Because what's the essence of fixing all the fractures and the person will not be able to function? You get it? So function is always number one. Key priority when you are fixing these fractures. Once you have healing, then you can look at the other aesthetic aspects of it.
His favorite word, aesthetic.
You're a maxillofacial surgeon.
Yes.
Is that your specialty?
Yes.
Wow. I mean, every other thing comes to you very easily, but I get that. I get the sense that you're really going on this and this. Wow.
Yeah.
So post-surgery, so this is what maxillofacial surgeons do.
Yes. So fixing fractures, removal of tumors, and all of that, depending on which region you're affecting.
Interesting.
Wow. How? So, if I'm seeing the images you're sharing, right?
Yeah.
Some of them clearly have affected the dental structure. Do you also, do surgery on the tooth area, the dental cavity, or you would say this is where the dentist comes in? Okay,
so I'm saying when you are fixing these fractures, you remember I said you fix it around the occlusion. The occlusion is the relationship of the upper jaw to the lower jaw.
Okay.
So certain times when you are doing, so there are two main ways of fixing these fractures. Either you do open reduction or closed reduction. So the open reduction, but regardless of whether open or closed reduction, you need to use the teeth and the relationship of the upper and the lower jaw to be able to get correct fixations. So for the closed reduction, most of the time, what you do is that you have to shut the teeth or shut the jaws through the teeth for not less than 6 weeks. You get it?
So you're not
so
talking
not less
for
than
6 weeks?
They would be able to still talk with their teeth shut. You will be able to still
I have like so
talk.
many
And then feeding would have to be through the back.
Tube? Through a tube?
Through using straws.
Okay.
But then there's some space at the back where you will still be able to put some food there. And then you have to be on soft
just
diet.
liquid.
Thank you. Yes, you're doing just soft diet.
Please forgive the ignorance, right? Because, of course, you didn't sit in your gay science classes and your medical school classes. So if a client comes to you, right, or a patient comes to you with this kind of, is it that you cut the faces open?
Okay. So what you do is that, you remember I said the injuries are soft and hard.
Yes, I remember that one.
So now the soft part, you would want to utilize the lacerations or already where there are some cuts to be able to assess the fractures.
What if there are no cuts?
If there are no cuts, then yes, there are standard places where you can cut to get access to the fracture line and fix, depending on where it is.
Mangled, like you are seeing in some of the images you've shared. So it means you make multiple cuts?
No, so most of the time for these, they come with certain lacerations.
Okay.
And these lacerations, you can utilize those lacerations so that you don't end up causing...
already openings, right?
Yes, already cuts.
Yeah. Okay,
so that you don't... So we call them pre-existing scar areas or pre-existing injury sites where you can still go through those injury sites to be able to access these fracture points and then fix. Other than that, for closed reductions, so this will be for open. For closed reductions, you may just have to manipulate. After manipulating, then you don't have to open directly to where the fracture points are, but you would just reduce using some instruments. Okay, after you reduce, then you put it, your rate determining step would be the occlusion, where you put it together for it to stay there and then heal.
Has there ever been a point where you or any of, you have to remove the whole face to fix?
Yes, there are certain times where you would have to do, let's say, jaw surgeries to cut part of the jaw away.
Oh no.
So if you have, let's say, a tumor which has affected one part of the jaw and it's affected, it's eating away the bone and all of that and affecting other soft tissue structures like the tongue, you know, the palate and all of that. Yes, there are certain times where you would have to do, so we call them resections, jaw resections, depending on the area that has been affected. Certain times you would have to even go and disarticulate the joint on this side.
Wow.
So once you cut, we call them hemimandibulectomies or segmental resections or marginal resections, where you would cut away that part. But after you cut away that part, then it means that you may have to reconstruct if the disease, the biology of the disease allows it. Because if they are cancerous, then you may have to wait a little bit more to see before you can do your reconstruction. But if they are benign, then, and you have clear margins, then you can go ahead and do your reconstruction.
So I'm guessing that depending on the type of injury,
Yes.
then
The treatment
will be given. And what
yes.
about the recovery time?
Recovery times, as I said, you will need about 6 weeks to be able to achieve some callus formation and some bone deposition in those areas. So after the 6 weeks, you would have to reassess. After reassessing, if everything is fine, certain times you may, if you are doing your close reduction, you may have to release the intermaxillary fixations and then wait to see if they are able to feed, talk, do all those things, the functions. If that has been resolved, then you can go ahead and remove all the other hardware that you used for the fixation in the closed reduction technique. So those are some of the things that you look at. So, you know, oftentimes people would say that, okay, if you do the closed reduction, that means that I'm going to be on soft diet for about 6 weeks. Okay, so it's either I'm taking smoothies or I'm taking just water and some other liquid stuff. So you would, so most patients are eager to get themselves out of that situation so that they can go back to their wache, their kinky, and
it's very interesting, right? And it's unfortunate time is not on our side because I have so many questions for you.
Okay.
Right, but maybe just help us with this. So post-surgery, everything is back. Would you say, for example, there are certain products that you may not be able to use again?
Products in terms of
irritants, right?
Okay, so if I get you right, is it in terms of eating or in terms of...
Maybe this is a whole different conversation, but basically, are there any things post-surgery that can trigger like imbalances?
So all right, I get it. So now, post-surgery, you'll be given certain instructions. So post-surgery starts from the moment you even finish or you put your last stitch in theater. So there are instructions. The instructions would be for at least for the first 6 weeks, you are not going to be eating anything hard. So it's all going to be soft to allow for that immobilization so that some healing will take place. Subsequently, after the 6 weeks, 2 weeks review, you'll be seen, and then you would gradually start to eat normal diet. But it's not at once. You would have to gradually start so that we should have ensured that the healing has started and is ongoing for a little bit before. And then when it comes typically to the fractures that affect the joint space, you are not, there's something we call, after we fix and then we release, you would have to do something we call TMJ exercises. Because the tendencies are that this joint space is very small. So you can end up bleeding into it. And when you bleed into it, deposition of bone would form, and then you may end up with something we call ankylosis. So ankylosis is like, it's healing. The bone is healing, the joint space is lost. So if the joint space is lost, remember it's a joint space that helps you to open and close. So imagine now that joint space is lost. That means that you may not be able to open again.
Wow.
You get it? So that is the ankylosis. So gradually you would be giving what you need to do to be able to come back to normal function fully when it comes to feeding, when it comes to speech, and then the other vital structures that were involved in such a situation. And then it also would come back to certain fractures. Let's say we have some complex fractures. So some complex fractures do involve certain nerves. You see, there's this small hole down there in the previous picture. There's a nerve that comes out there. So that nerves usually would help you have some sensation to your lower lip. You get it? So imagine that nerve through the fracture was severed.
Wow.
So if it was severed, it means that, and it wasn't repaired, it's not possible to repair, it means that you may lose sensation. You may not be able to feel your lower lip.
Wow.
You get it?
A listener
Certain
sent me
times too-
pictures. I would want you to.
Have a look.
Yeah.
Certain times too, there may be people who may have lost part of, let's say, there's some avulsion of certain parts
too
of their
gory.
body, which would need to be reconstructed gradually, depending on. So the instructions really do vary depending on the type of fracture that you do have, or the type of soft tissue.
I mean,
fracture that you
there's
do
a
have.
disclaimer. I mean, you see words like this, so yeah.
Okay,
Yeah.
all right.
Right, interesting.
So, you remember this incident?
I think he was attacked
Okay.
sometime.
Okay.
Yeah.
All right. So for him, it looks like he has, so when you look at the facial profile, there's some soft tissue injuries that he suffered. So I can see some lacerations on the upper right region involving the upper eyelid region. And then you can also see that the malar regions on either side was also affected. And even he had a little bit, there's a scar on the tip of the nose, which is also indicative that he suffered some abrasive injuries to that area. And then you can also see that there are certain concomitant injuries, which is involving the finger, the last but one finger on the right
And the
side.
finger is usually soft tissues, right?
Yes. So the finger also has
Hard tissues as well. Hey, Charlie.
the finger also has hard tissue. But then for him, this particular one, yes, he has mainly some soft tissue. But I won't be able to tell whether the hard tissue is involved until I examine.
Exactly.
Because what I can see, beyond what I can see, you need to what? Touch,
Examine.
which is palpation. So what I can see now is mainly soft tissue that has been lacerated and has some edema. But there may be the bone within the finger may have been fractured as well.
There's so much to talk about. Maybe we should probably continue next week, because
definitely.
pain post, how to manage.
Yes, the pain as well, and then yes, very
But I'm
important.
grateful for
We
your
can
time.
do that.
Dr.
Thank you too.
Kasum Zakaria Adam. So this falls under surgeries, right?
Yes,
So-
maxillofacial surgery.
and also plastic surgeries?
Yes, plastics as well.
Because usually when we talk about plastic surgeries here, it's it's actually a very thriving industry.
Yes, it is.
I hear
it
you
is.
people are very rich.
Plastic or maxillofacial. Maxillofacial surgeons are very rich outside Ghana. But here we are not. I like that caveat.
You didn't have to add that caveat,
Outside
right?
Ghana.
Because like it's become very trendy, right? Especially for some of our female friends, like they want to change a few things.
Yeah.
So it's a very lucrative industry.
Yes, it is. It is.
No, okay, I have to kind of
Depending
play
on-
tight.
Yeah.
Anyway, thank you so much for the time. We are grateful that you could spend your
Thank
morning
you.
running us through or taking us through this really insightful health conversation. So that's just by way of information. Miss the parts of YouTube, go view for yourself, share the link as well.